Welcome to Wednesday's edition of COVID-19. Just a day ahead of the start of the Seollal holiday or the Lunar New Year holiday, Korea has recorded more than 400 infections. Accordingly, authorities are warning about a possible resurgence should people fail to abide by social distancing during the 4-day national holiday. Now, we have more on the need for caution with our panel of experts later on the program. First up, I have Kwon-Soo standing by with the pandemic updates. So, do start us off for this Wednesday.
Yes, Sunny, as you said, we are seeing a surge in cases just ahead of the Seollal holidays or Lunar New Year holidays, with 141 more infections reported than yesterday, with the figure standing at 444 as of 12 a.m. And that also includes more than 400 domestic transmissions. With that, the country has now a total of 81,930 infections and a death toll at 1,486. Now, cases dropped to the 200s earlier this week, but now we have a similar figure to last Wednesday. And officials say that the country is at a critical juncture with a recent slowdown again turning into a rebound, calling for citizens' cooperation in flattening the curve.
With the third wave of COVID-19 still ongoing, the average number of infections in the past week stood at 346. The number is very high if we compare the figure to what we had ahead of Chuseok last year, which was around 80 infections.
And Yoon just mentioned Chuseok, which is Korea's Thanksgiving. And just like back then, authorities are asking for people to refrain from traveling across the nation, as we're still seeing most parts in the country with new infections. And if you do have to travel, special antivirus measures will be in effect during the Seollal holiday. And our Jessica Lee will be at one of the places in a bit later in the program. Meanwhile, we are seeing resurgences in the metropolitan region, including here in Gyeonggi-do Province, the city of Bucheon, an outbreak linked to a religious facility and a cram school confirmed over 50 infections. Now, 2 weeks after Seollal, on the 26th, the nation's people will begin to receive vaccinations for the coronavirus, with preparations in full swing. And that includes a mock drill that was conducted on Tuesday. For the vaccination administration process, it was aimed at preventing any accidents or mistakes that could happen, such as during the distribution process, and was especially focused on the Pfizer vaccine rollout, which involves the delicate procedure of moving and defrosting the product that needs to be stored at around minus 70 degrees Celsius.
Right, so meanwhile, I hear you've got some COVID-19 related news from across the border up in North Korea.
Right, and this coming from Russia's ambassador to North Korea, who said the country is suffering a shortage of daily necessities such as flour and sugar due to its year-long shutdown with nearby borders, although North Korea is still not reporting any official cases of COVID-19. Now, let's take a look at countries that are reporting cases and that are suffering with still high daily increases, such as the U.S., now close to 28 million infections, and Spain, meanwhile, has at the 3 million mark in total cases. And we see also increasing numbers in Iran, which has surpassed the figure in South Africa, while South Africa is still dealing with growing concerns over the COVID-19 variant there. And with that, the globe now has a total of almost 107.4 million infections, and we're also seeing over almost 13,000 new fatalities reported in the span of 24 hours. And those are the updates I have for now, but I'll be back after the Seollal holiday, so see you then. Back to you, Sunny.
All right, so safe holidays.
You too.
Right, authorities here held a town hall meeting with members of the public and medical experts yesterday to explore revisions, that is, to the current social distancing framework. I have Kim Hanil here in the studio with details on that and more. Welcome, Hanil.
Good afternoon.
So now, this meeting yesterday was the second of its kind to be held this month.
Right, so the first meeting was held last Tuesday, where the Korea Disease Control and Prevention Agency held convened a meeting with health experts to discuss the possibility of revising the current social distancing guidelines. And yesterday's follow-up was attended by business owners and field experts. A new suggestion was raised in the meeting where field experts suggested that the 9 p.m. curfew on businesses should only be applied under the highest social distancing level, and that the rules should be applied more flexibly depending on the type of business. The current 5-tier social distancing scheme was put in place following an overhaul of the earlier 3-tier system in November last year. Level 2.5 social distancing, which is the second highest on the ladder, has been issued in the Greater Seoul area, while the rest of the nation has been under Level 2 since December 8th. However, many small business owners have expressed growing discontent over the measures, saying the criteria governing restrictions on businesses were unfair and inconsistent. The government plans to announce its revised social distancing guidelines this Saturday.
Right, and Hannah, I believe the Prime Minister has addressed the public grievances of small businesses here in the metropolitan area.
Right, Prime Minister Chung Se-kyun said he was calling for public support and calling the public to oblige by the disease prevention protocols while acknowledging the struggles of small merchants in the capital region. During a pan-government meeting on Tuesday, Prime Minister Chung Se-kyun said he understands the anger and frustration being expressed by small business owners in the Greater Seoul area, where a 9 p.m. business curfew remains in place, while the curfew has been extended to 10 p.m. in other parts of the nation. However, he stressed that the decision to maintain the current level 2.5 social distancing restrictions until the end of Seollal was made with the public's interest in mind and after careful consideration of the transmission risks. The Prime Minister pointed out that the number of cases in the Greater Seoul region is still higher than the rest of the nation, with around 3/4 of the country's recent COVID-19 cases being reported in the capital area alone.
Meanwhile, Hannah, I hear there may be another round of financial support to ease the burden on those greatly affected by the pandemic. Tell us more.
Sure. So Korea's finance minister ordered a review on the current possibility of handing out extra rounds of emergency relief funds to people whose livelihoods have been severely impacted by COVID-19. During the meeting, Finance Minister Hong Nam-gi urged officials to swiftly complete the third round of emergency financial aid and start preparing for the fourth round of coronavirus relief payments. He added that priority should be directed towards people under heavy debt and those not covered by social safety nets. It appears likely that the government will pass an extra budget of 20 trillion won, or roughly $17 billion in the first quarter of this year, in order to finance its latest round of cash handouts.
All right, Hannah, as always, thank you for that coverage. Hope to see you again next week.
See you then.
Right, elsewhere around the world, Mexican President Andrés Manuel López Obrador claims he has recovered from COVID-19 after testing positive on the 24th of January, which has been the worst month for the country to date, as it recorded more than 1,000 losses of lives on a daily basis back then. For more, I have Kylie Madry joining us live. Hello, Kylie.
Hi, Sunny. Thanks for having me today.
Right, Kylie, let's start with President Obrador's press conference earlier this week regarding his health. What did he say and what was the public's response?
Yes, President López Obrador, also known as AMLO by his initials, has said that he is back to normal. He's feeling great after taking this experimental drug cocktail of anti-inflammatories and antiviral drugs. And people were not necessarily happy about that, especially as the situation has just gotten so dire here. The president was able to check into the hospital and take these experimental drugs, while many Mexicans, at the moment, our hospital beds are full, and people are choosing to stay at home and avoid treatment, and unfortunately dying at home. We also have an oxygen shortage as well. A black market has occurred where people are spending months' wages just to buy a day's worth of oxygen for their family. So I can't overstate just the juxtaposition between the two situations right now. People are not happy about it.
Right, Kylie. Meanwhile, Mexico's distribution of the first batches of Pfizer's vaccine took place just before Christmas last year. But I understand the rollout has already run into obstacles. Kylie, tell us more.
Yes. So at the moment, based on the timeline we've seen, we are still on schedule, but we're cutting it close and we need to ramp things up fast. We have about 700,000 doses that have gone out so far. That's doses, that's not people vaccinated. So about half that number in total. Those are just healthcare workers on the front lines who have been so impacted by this. Mexico is one of the deadliest countries at the moment for these frontline healthcare workers. And we are waiting on more to come in from Pfizer. We have the CanSino vaccine in China that is expected to be approved soon, and hopefully we can get that rolling out. And we have a number more coming in. We have these piecework deals. So hopefully we can get things ramped up soon.
Right. Kylie, meanwhile, how are authorities seeking to tackle the challenges in their inoculation drive, and how are people responding to these efforts?
Sure. I think we have two big issues here so far. There's the information gap and the infrastructure gap. Information gap, especially with the rolling out, the registration, getting signed up to get vaccinated. We just had the website launch last week to get Mexicans over the age of 60 signed up for their first doses of the vaccine, and that's 15,000 Mexicans who are over 60. And there's one website to get them all signed up. So, of course, the website went live, it crashed. People spent days just pressing refresh to get signed up. And now we're just hoping to see what happens, honestly, and hoping that Mexico's infrastructure, especially once we do receive these vaccines, we have the administration, we have the skills, we have the special equipment, such as the special refrigerators, that can really get this vaccine out to everyone, even people who may not have been able to sign up on the website, or people who live in rural areas where they will be far away from health centers.
Kylie, tell us a bit about the government's initial plan with regard to public inoculation. I mean, by when did authorities hope to have inoculated the majority of the public there?
So Mexico has said so far it wants to have every Mexican who is able to be vaccinated from ages 16 and up vaccinated by the end of March 2022. So that's next year. Again, at the moment, we're on schedule. We have the healthcare workers, Mexicans over the age of 60, in the process of getting signed up right now. And then it moves down by age group. So we have Mexicans over the age of 50, then over 40, then everyone else. But again, that is over 80 million Mexicans who will be eligible by the end of next March. And so far, we only have 700,000 shots out. So again, we do need to ramp things up quickly, but hopefully with these new deals coming in, we can stay on track.
Are we talking about new deals from China and Russia, or?
Yeah.
Meanwhile,
yes,
Kylie, right.
Sorry. Yes, so we are hoping for the CanSino vaccine from China to be approved. It just applied for approval in Mexico 4 days ago. Our foreign affairs minister has said that they're hoping to get that passed right away, and that we can get that single shot vaccine out, all Mexicans over the age of 60 vaccinated by the end of March.
I see.
So,
meanwhile, Kylie, one final question before I let you go. People are taking to the streets, I hear, in protest of shutdowns that have been affecting their livelihoods in the absence of tangible government support. Could you tell us a bit more about this?
Sure. So I will say, I think things are a bit different here in Mexico than the anti-mask or anti-lockdown protests that we've seen in other countries. Yes, it is true. Mexico has provided close to almost no financial aid to its citizens, very negligible. And so many Mexicans do live on the precipice. They live off of their day-to-day. They have to work, and they have to choose between working and risking getting the coronavirus or stay home and starve. So not good options either way. So people have kind of started to voice their anger at the government, saying we want to reopen. In Mexico City, where I am right now, we are in what's called the red light lockdown. Lockdown is a bit of a misnomer while things are shut down. Again, because of these protests, because of people being vocal, we're seeing restaurants open up again for outdoor dining, malls will be opening up again, and yet our hospitals are at capacity.
All right, Kylie, thank you very much for making the time to join us live at this particular hour with your thoughts.
Thanks for having me.
Right, as mentioned earlier, come tomorrow, we mark the start of the Solal holiday here in the country, and many are hoping to be with their family during this time while abiding by the stringent restriction on social gatherings. In this corner, we take you to a train station here in capital Seoul that is seeking to offer its travelers a safe ride back home. I have Jessica Lee standing by. Hello, Jessica.
Good afternoon, Sunny.
So, Jessica, which station are you at?
So right now I'm standing in front of Suseo SRT station in southeastern Seoul. It's a day before the Lunar New Year holidays here in South Korea, which is also known as Seollal. So the SRT has come up with a special antivirus prevention measure, which is the SRT Clean Zone. It aims to make people and visitors feel safe while you're using this high-speed train. So today, let's go inside and take a look at what exactly the SRT Clean Zone is. Let's go inside. You can probably get from the name SRT Clean Zone. It's operating under strict prevention, virus prevention and hygiene measures. So in order to get inside the station and to the SRT Clean Zone, we have to go through this gate. It's named Smart Sterilization Gate. So this gate will blow viruses with strong wind. So let's go inside and try how it works. So what's good and important about the smart sterilization gate is that it was installed in a railway station for the first time to remove not only the novel coronavirus, but also fine dust as well. After passing through this gate, I feel much more safe and relieved that it feels like a strong wind seems to remove both fine dust and droplets that can possibly contain viruses. So finally, I'm inside the station. Right now, I'm at the SRT Clean Zone. And as I mentioned earlier, the Lunar New Year holidays are just around the corner here in South Korea. However, since authorities announced and extended a special ban on private group gatherings of 5 or more people for 2 more weeks, it's relatively quiet around here, as you can see, compared to other usual holidays. Moreover, in fact, the ticket was almost actually sold out. However, ticket reservation rate was dropped by 11% this year compared to last year. And for safe use, the SRT is carrying out various virus prevention and hygiene measures here in the station. And one of the measures that's being carried here in the station is this quarantine robot. So the role of this quarantine robot is to sanitize frequently used spots such as information desk or ticket counters with ultraviolet rays and lights. And I also heard the robot will be introduced to the station during the upcoming holidays as well. So we do know a little bit about this robot, but in order to know a little bit more, we have an official from the SRT. So good afternoon. Thank you for joining our show. I have a question that is there any special reason why you are hiring this robot during especially the upcoming holidays?
During the Lunar holidays, many visitors, so with the robot, we can sanitize everywhere, such as ticket booths, ticket machines, and information center. So, moreover, we run a rubber not only last Korea Thanksgiving Day, but also the day of the National College Entrance Test. So, many students could go their test site safely in spite of the spread of COVID-19.
All right, then what have been quarantine measures, virus prevention measures being carried out here usually like?
First of all, we disinfect SRT stations more than 3 times a day. Especially, we run automatic sanitizer spray machines and thermal imaging cameras in every platforms and exits. Besides, in every restaurant of the Suso station, we set up sneeze guard on all the tables and operate air sanitizers to prevent droplet transmission. Also, since the last December, we have provided window seats only to follow social distancing measures. And we will continue our tight disinfection systems until the Lunar New Year holidays.
Thank you so much. So thanks to the quarantine robot and the efforts of SRT staff members, we're able to travel safely. If you're traveling other cities or visiting your parents or your hometown, please abide by the social distancing measures that's ongoing, which is that a ban on private group gatherings of 5 or more people. So please have a great holiday, but do remember that stay safe and healthy from COVID-19 as well. So this has been Jessica Lee reporting live from Suso SRT station. And back to you, Sunny, in the studio.
A safe holiday to you as well, and thank you for that coverage to our viewers here. We do apologize for the slight disruptions in audio with that connection.
백신이 들어올 겁니다. 그 이전에 준비를 철저히 하고 있어서 곧바로 접종이 시작될 것으로 그렇게 생각하고 있고요.
다양한 경로를 통해서 효과와 안전성에 대한 정보들을 수집하고 의사결정을 하도록 그렇게 하겠습니다.
방역당국은 이번 설 연휴를 맞아서 중앙방역대책본부를 중심으로 설 연휴 방역대책 체계를 구축하여 운영하고 코로나19 발생에 대응할 것입니다.
There are a number of important dates on the calendar this month as Korea is poised to usher in its New Year later this week. Amid concerns of a rebound in daily cases and prospects of travel, holiday travel that is, all ahead of the country's public inoculation, which will start on the 26th of this month. And speaking of that, AstraZeneca has been granted the green light by authorities here for vaccination, even on those above the age of 65, at the advice, that is, of healthcare experts. I have Professor Kim Moon-gyu from Yonsei University. Welcome back, Professor Kim.
Good afternoon.
And I also have Professor Sarah Ok Shin from Korea University. Welcome back, Professor Shin.
Thank you for having me.
Professor Kim, Korea is poised to begin its public vaccine inoculation on the 26th of this month. Do you believe preparations for this inoculation campaign are on track?
A little bit late, I guess. Korean government started the vaccine project about June last year, and it was a little bit weak drive compared to other Western countries. Leading countries who started much more earlier. And we must know that this is a contract between government and the vaccine company. So it's a little bit late, but good to hear that something is going on. And the important thing is, what kind of vaccine are we looking for? Are we looking for the vaccine that we think is the best or affordable? And since there are many kinds of vaccines, we have to also consider about the cold chain if you're going to use the RNA virus, and who's going to be the first to have the one, the priority issue. And once you start vaccinating, you must guarantee the supply line. It should be sufficient and not to be blocked There are some issues in other countries that they could not have the second dose. So these all things should be well prepared. But I'm positive because Korea is one of the best countries in the world to have the vaccination schedule, especially in the pediatric group. So I'm looking forward.
Right. Professor Shin, Korea is looking to import 5 different vaccines from Pfizer, Moderna, AstraZeneca, Janssen, and Novavax. What can you tell us about the efficacy of each of these vaccines?
So yeah, we have some good information on the efficacy and safety of all these 5 vaccines we are most likely to get. So the most effective vaccines so far are the Pfizer and Moderna vaccines. And these are so-called messenger RNA vaccines. And in terms of the safety, it seems like the Novavax vaccine, which was based on using conventional method of using protein, are considered to be the safest vaccine we have. So Pfizer and Moderna vaccines, they announced that more than 95 and 94% efficacy, respectively. So that's very high efficacy. But the downside is that the distribution and the storage, just like the Dr. Kim mentioned, that the messenger RNA vaccines have to be stored at very low temperature. So Pfizer one has to be stored at -70, whereas the Moderna one have to be stored at -20. So the cold chain problem can arise from storage issue. And then we have the AstraZeneca vaccines. This is the one that has caused some controversy in terms of efficacy in the elderly. Because they say that the data for the elderly vaccine trial was not enough. So that was some controversy there. But today, our government has announced that we'll start vaccinating using the AstraZeneca vaccine. So AstraZeneca vaccine is pretty safe and it's affordable, and that's a good advantage. But the variations in the efficacy could be a drawback. And then we have the Janssen vaccines, which will bring about 6 million doses in the second quarter. And this is also similar to AstraZeneca vaccine using the virus vector. And but the difference is that it can use only 1 dose. So rather than two doses that AstraZeneca vaccine offers, it has advantage. But the potential problem could be that this Janssen vaccine has shown lower efficacy rate against the strains from South Africa variation. So that could be another drawback. And lastly, we have Novavax vaccines, and this is using the conventional method of making vaccines using proteins, and the preventive efficacy is about 89%. But like Janssen vaccine, the preventive effect can go down to 57% against the variant viruses from South Africa. So that could be another drawback.
Mm-hmm. And staying with that, Professor Kim, what more can you tell us about the efficacy of these vaccines against the newly identified variants that we have from the UK, South Africa, and Brazil?
That new mutant issue is not the Korean issue yet, but we have to know what is going on outside. And I heard that South Africa withhold the use of AstraZeneca vaccine because it was not effective against the strain they have. As Professor Shin mentioned, the efficacy dropped a lot, about way down to 10%, and also the antibody titer was dropped. But still, we do not know about the effect on the mortality. Maybe the vaccine might still have some effect to prevent patients dying because of this new strain. If we move to other companies like Moderna and Pfizer, they are making their own documents, but still too early to make conclusion. Moderna, I think they are trying to modify their own mRNA a little bit to fight against the new strain in South Africa. And I think this is on the phase 1 trial maybe, and we have to watch for the result, what they have. And for Pfizer, they did some kind of in vitro study that the antibody made by the previous one, the original one, was fighting against the new strain. So it's just an in vitro study. So we have to see the data from the patients and the people who got the vaccination. And as Professor Shin mentioned, the Janssen and Novavax similar in that the effectiveness is dropping a little bit, but still they are more than 50%. When we hear 50%, we might be disappointed, but in the point of the epidemiologist, that's the line that is satisfied for being a vaccine. So still we have a hope.
Right. Now, as Professor Shin mentioned, Professor Kim, this afternoon, AstraZeneca's vaccine secured the green light from authorities here. And the vaccine can also be used now on those above the age of 65, provided there is the words of caution from healthcare experts. I understand last week, though, health experts had advised caution against using this on people above the age of 65. What are your thoughts as a medical professional yourself?
Well, some of the clinical studies had limitation at the beginning. I mean, it was an issue made by BMJ, an article of BMJ, but still, it's still an issue. And AstraZeneca did not include enough candidates age over 65. And also, even Pfizer did not include age over 65 at the phase 1 trial. So it's not the issue only for one product. So later on, they included the elderly. But we should be concerned not only to the effectiveness, but also for the safety in elderly patients. Usually, elderly people are not making good enough antibody immune response against the vaccination. So that's a concerning issue. And we got to analyze all the vaccines extensively, and still there are many results coming out. So we have to monitor their experiences of other countries, and if we can have a choice, I wish that we can use the best one for the elderly, because every day we see in the emergency room that usually the people more than 70, 80 are getting very progressive and becoming a very risky, going to a very risky situation.
Right, it's a very sad story there. Professor Shin, meanwhile, what can you tell us a bit about Russia's vaccine?
Yeah, so recently clinical trial 3 results of Russian vaccine was reported in an internationally recognized journal to prove its efficacy and safety. And this was sort of a turning point for this vaccine, because it has gotten very negative views initially, but now people are starting to see this Russian vaccine to be, the major player in this vaccine field against the coronavirus disease. The Russian vaccine was made on the same platform as AstraZeneca vaccine, so using viral vector. They are using this viral vector to deliver COVID-19 antigens to your body, so you can produce the antibodies against these antigens. But there's a clear difference between AstraZeneca vaccine and Russian vaccines, is that AstraZeneca vaccines use the same vector for the first dose and the second dose. So this might have, it might have caused that this, because of relatively low efficacy from this AstraZeneca vaccine, could be due to this using same vector, because using this same vector could reduce antigen's performance to induce antibodies in the second inoculation. But the Russian vaccines, they use two different vectors for the first and second inoculation. So they have avoided, this problem that AstraZeneca had. And I think that's a very smart strategy for Russian vaccines. And I think that's probably why Russian vaccines have, high efficacy as 89% or 91% people have reported. And I think it's a promising results.
Right. Meanwhile, an article penned by academics asserts you could still be contagious even after COVID-19 vaccination. I have Professor Michele Carbone from the University of Hawaii joining our talk virtually from the US now. Welcome to the program, Dr. Carbone.
Thank you very much for inviting me.
Right. Do start then by sharing with us details about your article.
The reason that the virus, that people that have been vaccinated can be infected others is that the vaccine is injected in our muscles, and there it produces antibody called IgG. Those antibodies circulate in our blood and protect us from getting the disease. But because the vaccine bypasses the mouth and the nose, that is the natural entry of the virus, we cannot produce mucosal antibody on the surface of the mouth and of the nose that are called IgA that would prevent the virus to colonize mouth and nose. And therefore, people can be protected, but the virus can still infect the nose and the mouth, and from there spread to other people. In fact, the AstraZeneca vaccine that you spoke about, when it was given to monkeys were protected when they're challenged with the virus in that they did not get disease, but vaccinated monkeys spread the virus to other monkeys as well as monkeys that had not been vaccinated. There was no difference because the virus could colonize their nose and mouth. Now, fortunately, a couple of days ago, Pfizer and Moderna have stated that their vaccine, for reasons that still cannot be explained, will induce a production of IgA and therefore that can protect people from being infected. If that were to be the case, it would be fantastic because it means that people who receive the Moderna or the Pfizer vaccine are sterilized as people who have been naturally infected. However, nobody has seen the data, so this is hearsay, is not a scientific fact. Of course, we hope that is true.
Right. So I suppose, Professor Carbone, in the meantime, it would be a great idea to wear your face masks even after vaccination then?
Well, right now, even after the vaccination, you need to wear the face mask because you could get infected and spread the virus to others.
Of course.
It's also important to understand how to use these face masks because face masks are good once they adhere to the face. If they don't adhere to the face, they are useless. And therefore, a good surgical mask that adheres to the face is efficient in protecting the person from being infected and from not infecting others. But those cloth masks that now you see many people use in the United States that are usually oversized, that makes folds, and there is space, they are not going to protect anybody. Imagine going snorkeling or scuba diving. Either your mask adheres to your face or you get water in. If you get water in, it's useless.
Right. Right. Professor Carbone, what are the implications of your findings as they come amid global vaccination efforts?
Say it again, please.
What are the implications of your findings amid the global vaccination campaign that is going around at the moment?
Basically, what you're talking about is when is that we can go back to our normal lives, which is very important for many reasons, including the fact that that this pandemic is causing a number of collateral deaths because people cannot go to the hospital to get preventive therapies that would save their lives.
Right.
First of all, those who have been infected are at practically no risk of being reinfected. infected. You heard today that there are 107 million people in the world who have been documented to be infected. Up front of that, there are only 20 or less documented reinfection. 20 out of 107 millions is less than the risk than getting on an airplane and falling down. So that means that those people are at the extremely low risk of becoming sick again.
Right.
Then there are the people who are going to receive the vaccines. They should also be able to go back to a normal life, especially if it's true that they do not spread the virus, at least those who receive the RNA vaccine. For the rest of the people, we will need to continue to wear masks until everybody has been vaccinated. There is a shortage of vaccine, and therefore it's not going to be easy to vaccinate everybody for the simple fact that it's impossible because there are not enough vaccine for everybody.
That is so
But as
true.
much as possible, we need to go back to a normal life.
We do. Meanwhile, Professor Kim, I believe you have a question for Professor Carbone.
Yes. Professor Carbone, it was nice to review your comprehensive article. Since we have a reinfection, there are people asking, saying that the COVID-19 survivor might need vaccination, and there are also the opposite opinion also. If we consider the secrety IgA from the mucosa, do you think that we still need that it's going to work for the mutant strain?
I hope that it's going to work for the mutant strain. And I think that also the vaccine can work with the mutant strain. Now, of course, we are putting the virus under pressure now, because as people get vaccinated, if there is a variant of the virus that can spread in spite of the vaccine, we are going to select it. We haven't seen that yet, because the virus was not under pressure. But once you vaccinate people, if there is a variant that can go around the antibodies, that will spread. So you can anticipate that the risk that such variant exists may appear. The fact is that right now, with the tremendous shortage of vaccines that there is, and with the demonstrated lack of reinfection that there is among those who have been infected, it seems very difficult for me to justify to use a dose of vaccine for someone who most likely, almost certainly, does not need it, when there are so many people who very much need the vaccine. So that's the first reason. The second one is that if you look at the first data that are out there, if you give 2 doses, at the first dose, say you get a level of antibody 50, then after 2 weeks you give the second dose and you go to 100. When you give the vaccine to somebody who has already been infected, you get to 100 after the first injection. So certainly you don't need the second dose, but they give the second dose, and those are the people who are getting more sick, because as you say, this vaccine goes side effect. So as you look at it, it's difficult to justify why to vaccinate people who have been infected.
I see. All right, Professor Carbone, thank you very much for making the time to join us live to share your thoughts.
Sure. Good night.
Right. Professor Shin, what are your thoughts on the idea of inoculating those who recovered from their bout with COVID-19?
Well, so far we do believe that, vaccination is no exception for those who have been infected and cured. This is because cases of reinfection are rare but can occur, right? Having said that, there's some good evidence to show that these people who have been infected and being cured would cause robust immune response after just 1 dose of vaccination. So that means they can make a good amount of antibodies with just 1 dose. So I think we can assume that people who have been infected and cured in the past can secure enough immunity with just 1 dose instead of 2 doses. So we can rethink about, using different strategies or vaccine guidelines for those who have been infected and cured.
Right. Meanwhile, Professor Kim, we are heading to the start of the Salal holiday with our daily cases back up on the 400 level. Given this disturbing reality, what are your words of advice, that is, with regard to social distancing this national holiday?
Well, still, since the government is saying 5 members, we have to define who is going to be the 5.
Oh, I think it's 4 members.
4, I'm sorry, 4, yeah. So if you are with your 4, then you don't need to quarantine measures. But if anybody is added to that 4, then everybody should wear mask and keep the social distance and hygiene. Eating together, you should be very cautious. And if you have a member who is older than 65 or have diabetes or any chronic conditions or cancer, then I would say that we need extra caution. And maybe you should have a outdoors activity like walking short distance instead of eating together.
Right. All right, Dr. Kim and Professor Kim, of course, thank you very much for your time today. And Professor Shin, thank you for your insights.
Oh, thank you.
Right, now as I mentioned earlier, AstraZeneca's vaccine has been granted the green light by authorities here today to also be vaccinated on those above the age of 65, provided they have the advice of health experts as well. Have a happy Salah. We'll be back on Monday. Thank you for watching.